Thank you for joining us once again here at Senior Mark TV. I'm Dan Holscher, and today I want to begin our series called Medicare Alphabet Soup. And it's what do all the letters mean? Medicare can be a little confusing because of all the letters and what parts they stand for. But today we're going to go through those. I'm going to summarize what those 4 parts of Medicare are, and then I'm going to go into a little more detail on just the Medicare Part A. So when you break it down, Medicare is broken up into 4 parts. Part A is your hospital insurance. Part B is your medical insurance, and that basically is everything that is not hospital related. So anything that's inpatient hospital falls under Part A. Anything that is everything else, doctor's office visits, lab work, all of that will fall into Part B. Part C of Medicare is the Medicare Advantage program. We'll go into more detail on that program down the road, but in essence, it's an alternative to the traditional Medicare system of Part A and Part B. And then finally, we have Medicare Part D, which is your prescription drug program, and that is, you can kind of remember that D is for drugs. So let's break down what Part A does cover. It covers inpatient care in hospitals. It covers inpatient care in skilled nursing facilities. It covers home health and hospice care. And one important thing to remember is it does not cover custodial long-term care. Now, it will cover skilled care that sometimes is done in a nursing home, but it does not cover custodial care. So how does Part A cover your hospital coverage? For the first, and these numbers are 2010 numbers, first of all. And secondly, they are assuming that you do not have any type of a supplement insurance. So if you look at the first 60 days that you would spend in a hospital, Medicare is going to pay everything except for an $1,100 deductible, and that is per benefit period. So you could potentially have up to 3 deductibles within a 1-year period. So once you've been out of the hospital for 60 consecutive days, the benefit period starts all over again, and you'd be responsible for that $1,100 deductible for the second hospital stay you'd have in a year. After those first 60 days, the 61st through the 90th day, Medicare is going to pay everything except for a $275 a day, that's per day, co-insurance that you would be responsible for. After the 90th day, the 91st day and after, you have 60 lifetime reserve days. What those are days that once you use them, you lose them. So if you use one of your lifetime reserve days, you only have 59 left. During those 60 lifetime reserve days, you are responsible. Medicare, I guess, pays everything except for a $550 a day co-insurance that you would be responsible for. After you've used up those 60 lifetime reserve days, once they're exhausted, Medicare no longer covers, and you'd be responsible for the entire bill. So how does Part A cover skilled nursing facility? Skilled nursing facility is if, let's say you have a knee replacement or a hip replacement and you have to go into a long-term care facility and they're going to rehab you and send you back home. That's considered skilled care. So for the first 20 days, Medicare is going to pay everything for those first 20 days. On the 21st through the 100th day, Medicare will pay everything except for a $137.50 copay. On the 101st day and after, Medicare no longer covers that. This also will reset. So after you've been out of the hospital for 60 consecutive days, out of the hospital or skilled nursing facility for 60 consecutive days, you will get another 100 days of coverage. Thirdly, how does Medicare cover hospice care? Medicare is very good at covering for hospice care, so they pay almost all of it, but a very limited co-insurance for outpatient drugs and inpatient respite care. So that takes care of Part A of Medicare. So before you leave today, if you could do 3 things for me. Number 1, please subscribe to our blog. If you look in the upper right-hand corner of your screen, you can put your email address in there and click on the button that says sign me up, and that will alert you by email every time we add new content to the blog. Secondly, leave a comment. I want to see interaction. I want to hear what your ideas are, what kind of questions you guys have, any ideas for future programs that you would like to see. And finally, tell your friends and family to visit seniormarktv.com. We're going to have a lot of good content on here, and we know that people out there have a lot of the same questions you do, so please feel free to share. Finally, until next time, we're going to be covering probably Part B of Medicare. It'll be fairly short, but we'll go into more detail on Part B, and then Part C and Part D will come even further on in the weeks to come. So until next time, thanks for joining us.